Hello, viewers. You're welcome to our enlightenment program that seeks to enlighten you on issues that relate to your brain and spine health. My name is Dr. Ubong Ekpene, a consultant neurosurgeon with the University of Uyo, Teaching Hospital Uyo in Akwa Ibom State, Nigeria, and a lecturer with the University of Uyo. In our previous videos, we had considered the symptom headache, and we looked at the fact that headache can be primary if there is no clear underlying cause, or it could be secondary where there are clear underlying causes. And we considered brain tumor, several of them, as a cause of secondary headache, and we also considered in our last video head injury as a possible cause of secondary headache. Today we are going to consider another very important condition, neurosurgical condition, that can affect the brain and cause headache, and that is chronic subdural hematoma. Chronic subdural hematoma has to do with bleeding that occurs in the head within the layers of the coverings of the brain. To give you some perspective, the head, our head, has the scalp, which is a soft component, the skin of the head. Just beneath that scalp, we have the skull. And beneath the skull, we have the brain. Now, the brain is surrounded by 3 layers of tissue. And they are the dura mater, the arachnoid mater, the middle layer, and the inner layer, the pia mater. When blood slowly accumulates between the outer dura mater and the middle arachnoid mater, that bleed is called subdural hematoma. And if it has occurred over a long period of time, then it becomes chronic subdural hematoma. And that is what we are discussing today. If it accumulates to a certain quantity that compresses the brain, then it can result in symptoms that we'll look at in a couple of minutes. What are the risk factors for developing this condition? First of all, it occurs mostly among the aged people, those who are in their 60s, 65 and above. These people tend to have the brain shrink. As one ages, the brain naturally shrinks, and there's a lot of space around the brain. Now, this space between the brain and the dura mater has veins that run within them called bridging veins. These veins, as the brain shrinks, it stretches them out, and minor traumas can lead to their rupturing and bleeding because there's a lot of space around the brain at this time. That blood leaks gradually and fills up that space and compresses the brain and can lead to symptoms. Another risk factor is alcoholism. People who tend to abuse alcohol are predisposed to having their brains shrink faster than the normal people. So a 35-year, 25-year-old, 30-year-old alcoholic could have the brain size of a person who is in the 65 years of age. And that means a lot of space around. Secondly, alcohol damages the blood vessels. When it damages the blood vessels, it makes the blood vessels more prone to tearing and leaking blood. Thirdly, alcohol damages the liver with chronic usage. When it damages the liver produces important chemicals called blood clotting factors that help the blood clot well. It helps the blood seal up the vessels when there is injury. So when the liver is damaged, then it can impair the functioning of these factors. And that occurs a lot in people who are alcoholics. Then lastly, alcoholics tend to fall a lot under the influence of alcohol. So with the combination of these, the alcoholics tend to be more predisposed than the regular general population to developing this condition besides the elderly. The third risk factor is patients who are placed on, who take anticoagulants, either because of the medical condition that they have For instance, patients who have deep vein thrombosis. Deep vein thrombosis simply means that there's accumulation of certain plaques, things within the blood vessels that narrows it gradually. And that can cause the functioning of the veins to be impaired. Sometimes those things, those clots, dislodge and can run within the blood, get to the heart, or block the lungs and cause the patient to have difficulty with breathing suddenly and death. So these patients are usually placed or given this medication so that they don't, just to release the risk of developing this pulmonary embolism. Patients who have had ischemic stroke in the past are put on medications like this too. And then, of course, hypertensives and diabetics, those ones also may be taking some of these medications. These medications include heparin, warfarin, apixaban, dabigatran. Patients who are on aspirin, clopidogrel. These are all drugs that has the tendency to make the blood more fluidy. They help to prevent clots from forming in the vein, but they also increases the risk of prolonged bleeding with their usage. So patients who are on them, if they have a fall and those vessels are ruptured, the blood don't clot easily. And because of that, it leaks gradually into the spaces around the brain and can cause this condition called chronic subdural haematoma. Trauma of any cause could range from minor trauma, like hitting your head on the wall in a dark room, trying to enter into your car and then hitting your head on the roof of the car or the door of the car. Sometimes patients don't even remember those trivial traumas, but these actually could be what would trigger the condition. In the younger people, it tends to occur more following more serious accidents like assault to the head, road traffic accident, etc. That initial injury may have resolved, but a bleed would have started. That bleed gradually accumulates and over time can compress the brain and cause the symptoms that we'll talk about. Now, what are the symptoms of this condition? The commonest symptom of chronic subdural hematoma is headache. We'll start with a mild headache, progressively worsens over time. And this headache may be associated when it's significant with nausea, with vomiting. It could also be associated with convulsions, seizures. It could also be present with symptoms like stroke. One side of the body is weak, and that is because the blood is accumulating and compressing on the opposite side of the brain. That weakens the opposite side of the body. And it could also present with problem with vision, sometimes with memory problems. Patient can't remember things. Could also present with the patient having deterioration in intelligence. And sometimes it mimics a condition called dementia, but it may actually mean that a bleed is occurring in that brain. There are other symptoms. It could progress to loss of consciousness and even death if intervention is not done in time. If you have a patient who has such symptoms, what should you do? That patient must be taken to the hospital as soon as possible. A doctor must see and evaluate that patient, take a history. If there's a clear history of a trauma in the recent past, or this patient has any of the symptoms that suggest that there is a problem with the brain, and is examined, and that confirms that a scan of the brain needs to be done quickly. If the scan shows a crescentic appearing, crescent is like a segment of the moon appearing within the intracranial cavity, compressing the brain, that tells us that we're dealing with a subdural hematoma. If it looks darker than the brain, then that's a chronic subdural hematoma. That patient needs an emergency surgery. Some patients have it's very small and we manage conservatively. But a lot of times when they come with those symptoms and this accumulation is significant enough, that patient needs an emergency surgery. Emergency surgery can be life-saving. Simple surgery, but the recovery is usually excellent if intervention is done in time. But if intervention is not done in time, it can actually lead to unfortunate, untimely death. So it's very important that you share this video. You can never know who maybe having symptoms like this who will benefit. And how can you prevent this condition? We have mentioned some of the risk factors. Aging, you cannot do anything about your age, but you can do something about falling. So measures should be put in place where elderly people are to prevent falls in the house and at work, just to limit the risk of developing this condition. Alcoholics, you've seen the problems that alcohol can cause to your liver, to your blood vessel, can also affect the brain itself. You need to kick that habit so that you can prevent yourself from developing this condition. And those who are on anticoagulants must be monitored. The monitoring will involve checking for the fluidity of the blood. There are certain parameters that will be assessed to see that the blood is not too fluidy. And if it is, the drug itself can be regulated. And so it's very important that this must be noted. If you have had an injury in the past, head injury, and you are now 3 weeks, 4 weeks, 5 weeks down the line developing persistent headache, you need to see your doctor immediately. This may be a chronic subdural hematoma that may be forming. Early intervention can be life-saving. Delay can be dangerous. Please share the video, click on the like, click on the notification button. You can subscribe to this channel so that other videos can be made available to you. Thank you and God bless.